Insomnia in children in general and infants, in particular, is a sleep disorder, in which the child finds it difficult to fall asleep or stay awake at night, and the main complaints of insomnia and lack of sleep are drowsiness in general during the day, feeling tired and lack of energy, and insomnia in children can be classified according to its duration, severity, and extent. The infant's lack of sleep or insomnia is usually short-lived, from a few days to a few weeks, and is caused by multiple factors such as a specific illness or medication. In this article, we will learn about this disorder that usually affects the infant, which is the reason for the lack of sleep in the infant, and some tips to get rid of this problem, so come with us. Why is proper sleep for the child necessary? In the beginning and before we get to know the causes of lack of sleep in the infant, it is necessary to know some important facts about sleep and its necessity for the child. Adequate sleep for children is one of the main sources of their healthy development, especially at the beginning of their birth, meaning that sleep is the basis in the first period of the birth of the infant. Most growth hormones are secreted during sleep at night, and even sleeping for 4 to 5 hours at night gives a child enough energy the next day for play and movement. The baby's sleep at night also allows the parents to get enough rest and a healthy lifestyle. In addition, adequate sleep allows the child to focus and use his mental abilities effectively and enhances his academic and scientific progress in the future. The nature of children's sleep. Newborns can sleep from 16 to 20 hours a day, wake up every 2 to 3 hours, and continue to sleep after consuming breast milk, as in this period there is no difference between day and night for them. What are the causes of infant sleep deprivation? Reasons for a baby's lack of sleep. 1. After 2 months of age, babies usually sleep 10 to 12 hours and up to 6 months for longer at night, and then the uninterrupted period of sleep begins at 3 years of age. The inability of the infant to sleep, lack of sleep, waking up frequently during sleep, and not returning to sleep upon awakening may be a precursor to their sleep disturbances. Among the most important reasons that have a role in the infant's lack of sleep are: hunger and thirst are among the causes of lack of sleep in infants. Hunger is the most important reason that causes a baby to sleep less and be sleepy, especially at night. Even if you breastfeed your baby regularly, he may still be hungry during the night or before bed. So your baby should eat at least once every hour, because in the first 6 months he wakes up more during the night to eat complementary foods because breast milk is easy to digest. As your baby grows older, he needs more meals and will feel hungry more than usual, in addition to feeling thirsty, so you must regularly give him water in a certain period after the age of 2 months. No burping after feeding. Baby feeling excessively hungry or full and not burping in the right way can also cause difficulty sleeping, so make sure that your baby burps after his meal or feeding in the right way, because he will still be tense and difficult to sleep. Maternal depression. If the mother is depressed, sleep disturbances may appear in the infant, because most studies have proven the relationship of emotions and the psychological state of the nursing mother to her infant and his psychological state, which clearly appears in his lack of sleep. Because one of the main causes of sleep disorders may be of physical or emotional origin, transmitted from the mother to her infant through the milk that he breastfeeds from her. The baby needs deep sleep in a certain position. Reasons for the baby's lack of sleep. 3. A child wakes up once or twice during the night, but most children know how to fall asleep and fall back asleep. But your baby may be used to sleeping on certain things like breastfeeding, a bottle, or a pacifier. This is one of the most common problems parents face with an irregular baby's sleep. To solve this problem, you must train your child during the day and teach him to sleep without the need for food, a bottle, or a pacifier when he wakes up during a nap. Lack of sleep in infants due to young age. The number of children who can get used to the routine of falling asleep very quickly and sleeping comfortably through the night is very small. For the first 2 months of life, babies sleep at random intervals for 12 to 18 hours a day. By the age of 9 months most babies can sleep well through the night, but keep in mind that for these babies, sleep all night means 5 to 6 hours in a row, so if your newborn doesn't sleep easily at night, don't worry, because this is perfectly normal. Sleep apnea or obstruction in the respiratory system. Although these cases are very rare, some infants cannot sleep easily due to respiratory blockage. Airway obstruction is often caused by enlarged tonsils and nasal passages called sinuses, and this blockage can be one of the reasons babies do not sleep properly. General. Children with this condition usually snore loudly, have difficulty breathing, and have difficulty sleeping. The incidence of children with this condition is 1% and it is usually common between the ages of 3 to 7 years. Due to allergies, asthma and other diseases. Some physical problems can lead to insomnia in infants, and consequently lack of sleep, as a stuffy nose due to allergies, colds and asthma can make it difficult for the infant to breathe. Baby colic, bloating, gas, reflux, coughing or earache can also lead to poor sleep, so your baby's pediatrician may be able to help you further. In case of cough and respiratory illness, you can use a humidifier such as incense or light essential oils in the room. In the case of other diseases, such as stomach pain or pain caused by bloating, his stomach can be rubbed with one of the soothing oils. Lack of sleep in infants due to medication. Some cold and allergy medications or ADHD medications can affect your baby's sleep. If you think your baby's medications are affecting his or her sleep, talk to your pediatrician. Changing the medication or dosage can help improve your baby's